Thank you for joining us for the item system training session today. I'm Libby Shepherd and I'm going to be talking to you about the Competencies and Journal module, which are going to be used as part of the Allied Health Professionals Prescribing training program to collect the information required to complete the Learning and Practice module. During this training session, we'll be using the chat section, which you can see on your web page, which will allow you to ask us questions and we will answer your questions this way as well. At the end of this training session, you will know how to access the item system and troubleshoot any login issues. You'll understand how to use your dashboard, including how to view and amend your profile, view messages and access the modules, including the Competencies and the Journal module. We'll look at how you carry out a formal assessment and a self-assessment in the Competencies module. And in the Journal module, we'll look at how to add entries and upload supporting evidence. And we'll also look at how you can use the help guide to assist you in using the item system. Before we look at the actual system, I wanted to talk about access to the system and the support available. Due to the age of Internet Explorers in Queensland health organisations, the best way to access the system for its optimal viewing is through Mozilla Firefox browser. And this can be done at home as well. It's a free download. It will be compatible with very up-to-date browsers, but we would recommend that Mozilla is used as the primary browser wherever possible. To access the system, you've been sent a username and password. Your username is your email address, which was given to us through QUT, and your password you change to a password that is preferable to you at your first login, and you will need to change your password every 3 months. We'll go through login issues when we go through the system. Access through the system is through a secure server at system.itemsforhealth.com.au. So in terms of training, you will all receive access to one webinar training session, which is this one. There are more available on request, but we believe this would be enough for you together with the online help guide to get you through the system. The online help guide has written help as well as a video walkthrough. So everything we're going to talk about today will also be in the help guide, so you can refer to it any time. We have a live chat system that's available through the website, so you just click on the help icon at the bottom of each page. This is available between 8 AM and 8 PM, Monday to Friday. If for any reason you need to contact us outside these hours, you can leave a message with your contact details and we'll be in touch with you. You may be aware that this version of the item system is just new to the market this week, so inevitably there probably will be some errors or bugs throughout the system, which just occurs as it is a software system. So if you want to report any of those, you can report it through the help guide by just typing in error in the search box, and that will take you to our live chat, and you can give us the information about the errors occurring on the page. Alternatively, you can contact us via email at support@itemsforhealth.com.au, and that email is on the email you received with your username and password. So if you keep that, you'll always have access to the email. We will be updating the system throughout the time you're having it, so we'll inform you via the message board on the system and via email when this happens, so you're completely aware of what's happening. So when you log into system.itemsforhealth.com.au, you'll be taken to the login page. So you just need to enter in your email address and your password. If for any reason that you forget your password, you can always request a new password by just clicking on Forgot Your Password. You'll enter your email address in and a new password will be sent to that email address. If you do attempt to log into the system and fail, you have 3 attempts before you're locked out of the system. You'll then have a 20-minute cooling off period and you can try again, or alternatively you can just click on the Forgot Your Password link and reset it and start again. The dashboard is the home page of the system, and on the dashboard we will look at how you can access your profile, including changing your email address and resetting passwords. We'll look at how you can receive messages and send messages. We'll also talk briefly about the Competencies Quadrant and the chart that will be available for you to plot your progress. And we'll look at how to access the modules, including the Journal module. So when you log in, you'll see your dashboard. Now on your dashboard on the top right hand corner is your profile. Now if we click on the My Profile link, you'll see that you'll have your email address, which you can change at any time. So for example, if it's your work email address here and you are going to be away from work for an extended period of time, you can actually change this to your personal email address. If you do this, you have to remember that your username will change because your username is always your email. At any time, you can also change your password by clicking on the Change Password button. And if you choose to do so, you can upload a photo which will become your avatar photo. And to go back to My Dashboard, you always click on the My Dashboard item within your navigation bar. So here we have the My Dashboard, and then we have modules. Within the modules, for the use of this training program, we'll have the Competencies module and the Journal module. So first of all, we're going to have a look at the Messages Quadrant. Now the Messages Quadrant will be used by your module coordinators to communicate information, particularly about the item system, to you to complement the information that they put on Blackboard. So an example of this are some guidelines on how they want to record your journal entries, in particular how to record your case studies, for example, and your learning and practice hours. Every time you get a message in the item system, you also get notified via email that you have a message on the system, so you can just log into the system when you receive that message. To view the message, and click on the subject title, and that opens up the message. Gives you a little bit more information, and if there are any attachments uploaded, you can click on the link to view that attachment. If you wanted to delete the message, you can delete it by clicking on the X, and if you do that, you can always access them in the archive, which stores your deleted messages. The Competencies Quadrant will provide a chart with your 10 competencies that you need to complete and your progress towards completing them throughout the training program. Now this quadrant and the graph will be available in the next week or two, so once you start completing your assessments, you'll be able to just identify your progress very easily by just clicking onto the item system and viewing your dashboard. Now to go to the module, we just need to click on the Go To button within the quadrant or via the modules menu. So we're now going to look at the Competencies module. And it's in this module where you will carry out your formal assessments with your DMP assessor against each of the competencies assigned to you during this training program. The formal assessments can be carried out in two ways. The first is over the shoulder assessment process. Now this means that you sit down with your DMP assessor at the computer, you log into the item system, and they carry out the formal assessment process. Now this can be done with direct entry into the system following an assessment, or it can be done following a bedside assessment where you have been assessed in the clinical area using the hard copy template, which we'll go through when we look at the system. The other way the DMP assessor can carry out a formal assessment is via remote access. So this means the DMP assessor can log into the item system with their own username and password and carry out the formal assessment without you being present. Now this is obviously ideal in situations where you're carrying out a lot of bedside assessments with the hard copy template and you want to enter the information from those templates into the system at a later date. We're also going to touch on self-assessment, although this is not a requirement of the course, although it could be quite helpful for you. And we'll look at how you can review all of your assessments that you've carried out over the training program. Now on the Competencies module, we have two pages. We have the Competencies tab, which is your active competency assessment. So this is your latest assessments carried out. And if you want to view your previous assessments or in progress assessments, you can click on the History tab. So we're going to start by looking at the Competencies tab. So on the tab, I just want to talk a little bit about what you can see. So we have a number of columns. The first one is Group, which is the prescribing group of competencies. We next have the Competency Code. Now, if you hover over the code, you can actually see what category that code fits within. You then have the name of the competency, the latest score that you achieved for that competency, the date of the assessment, and then the type of assessment. So a self-assessment is one that's carried out by you, and this is not something that is marked by the university. This is just something that will help you reflect on your progress and identify your needs before you go for a formal assessment. So it is up to you if you want to do that. Or you have a formal assessment. Now, formal assessment is both your formative and summative assessments. A formative assessment just means that you haven't quite reached the competency level that you're hoping to by the end of the training program. It's like a progressive assessment and helps you identify your needs, whereas your summative assessment is your final assessment. So that's the last score that you're going to achieve for that assessment. So in order to carry out a formal assessment, this needs to be done with your DMP assessor. So you can see here we have two links. We have a link for Start a Self-Assessment. So if you wanted to do a self-assessment, you would click that link, and then you have Start a Formal Assessment. Now, if you try to click on this, you won't be able to carry out the assessment because it has to be done by your DMP assessor. So I'll come back to that in a moment. Now, on the right-hand side, you have a column called Evidence. Now, what we have provided here within the evidence for each of the competencies is a hard copy template that you can download for each of the assessment, which actually mirrors the assessment process. Now, this is to be used for your bedside assessment. So, for example, if you're in a clinical area such as a ward or an outpatient clinic, and it is very difficult for your assessor to use an electronic version of the system to carry out your assessment, you can download this assessment. They can complete it in hard copy and then put it onto the system either immediately after you do the assessment at an appropriate time when there's no patients there, or at a later date. So you can see here we have a template that you can print out. It still has a descriptor for each of the competency scores. It has the performance criteria, any additional information. It allows the assessor to score you between a scoring system of 1 to 3, add comments for each criteria, and if we scroll down, some overall comments as well. Now, if you are going to use this, please ensure that you complete it by putting your name up the top of the form, and then ensuring that your DMP assessor puts in their name, their signature, and the date of the assessment. So to go back to the competencies page, you just click the Back to Competencies button. Now, although you won't be completing a formal assessment yourself, I will just go through the process so you can understand what to do. Now, your DMP assessors will be able to access training as well, but it's very good for you to be able to understand the process. So if there are any issues, you can talk them through it. So if we were to complete a formal assessment, if you click on the formal assessment link, it will ask you to enter in your assessor's username and password. So you will not be able to do this yourself. You will have to do it alongside your assessor. One thing to remember when entering in the username and password to carry out the formal assessment, that if you enter in the wrong password, you need to look at the bottom of the page and you can see that the username and password do not match. Now, if you do that 3 times, you will be locked out of the system. So please be aware of what your password is. Ensure there's no cap locks on or num locks on. And obviously, if you are locked out of the account, you can go back to the login page and reset your password and start again, or just wait 20 minutes and try again. So that takes us to the assessment page. Now, on the assessment page, we have a progress bar. So we have the assessment page, we have an evidence page, and we have an overview page. For the purposes of using this competency module for this particular training program, you're not required to record evidence for the particular competencies for your DMP assessor, so we're going to skip that in the training session today. So on this page, you can look at your competency description and how it's mapped to the MPS competencies. We can also look at the scale description. So 1 is less than competent, 2 is competent, which is the level you need to be at by the end of the training program. 3 is very competent. So this is like an expert practitioner who can teach others. And then we have an NA option. So this can be a number of options. It could be that the criteria wasn't relevant to the case or that you did not demonstrate it. But if that was the case, that the DMP assessor needs to say if the criteria was essential or not essential to the case. So every time they click an NA option for each of the criteria, they need to actually leave comments for your coordinators to assess so they understand why the NA option was chosen. On the assessment page itself, you can hover over the score so you can actually see what each of the scores mean. And then if we look at the performance criteria themselves, we have the main criteria at the front, and then we have some additional information underneath it, which will be used by your DMP assessors to just assist them in determining what level you achieved for that criteria. And then for them to score you, they just simply click on the box that's relevant for that criteria and that score. If they make a mistake, they can just move it across again and tick the relevant box. If for any reason they weren't able to complete the assessment at that particular time, they can click Save for Later. And if that's the case, you'll see an In Progress link on that Competencies tab. So you'll click on that in order to get back to this assessment rather than clicking the Start Formal Assessment link. But if you are ready to continue and sign it off, you just click on the Review and Finalise Assessment button, which takes you to an overview page. And this page allows you to view the scores achieved, but also it allows your assessor to leave notes about each of the individual criteria and also leave some overall notes about the assessment, and also allowing you to leave some notes as well. Now again, at this stage we can save for later or we can finalise the assessment. So if we finalise the assessment, you can see there's a little message at the bottom there that it has been finalised. And if we go back to the Competencies tab, you can see here that you're scored a level 1. It has today's date and it's a formal assessment. If we were to look at the history page then, we can see that the last assessment carried out was on KC2, it was a level 1, and would also have the name of your DMP assessor here. If you wanted to review this again, you can just click on the overview link. If there were any notes left here, you can click on the Show Notes or Hide Notes link, or the ones that appear directly underneath each criteria. And if at any reason there was a discrepancy in the assessment and the assessor wanted to change the assessment, they can do so. They will just need to click on the Edit Assessment button and enter in their username and password in order to amend that assessment. And that just takes you back to the assessment page. You can make the amendments as you're required and then click the Review and Finalise button in order to take you back to the overview page. So here on the overview page, you can see the scores have been changed, and again we can finalise the assessment. So we've shown you how to carry out a formal assessment with your DMP assessor, which is a requirement of the course. I just want to show you how to do a self-assessment. Now this isn't a requirement, as mentioned before. This is just a way to reflect on your own practice and plot your own progress, so it's easier to identify what you need to do for your formal assessment. So to start a self-assessment, click on the Start Self-Assessment link. You can see the page is exactly the same apart from it's a self-assessment rather than a formal assessment. You can backdate the assessments if required, and you can look at the criteria and the additional information that the DMP sees when they're carrying out the formal assessment, which will help you understand what you need to demonstrate in order to achieve a competent level in each of the criteria. As a self-reflection, you just click on the criteria that reflects the score that you're achieving at that time, and then you click Overview, and that takes you to the Overview page. It allows you to record your own personal notes for each of the criteria and some overall notes, and again you can save for later or finalise the assessment to sign it off. In the Journal module, we're going to look at how you can record your learning and practice hours, upload your case study assessments, add personal journal entries and upload supporting evidence. To access your journal from your dashboard, go to the Modules menu in your navigation bar and click Journal. To add all your journal entries, just click on Add Entry. And then for the time being, we haven't got the hours box in here for the learning and practice hours. So in the title, to record your learning and practice hours, if you just put in the hour and then learning and practice hour after it. Then you can put the date. Now I'm aware some of you have started earlier, so you can backdate your learning and practice hours if you choose to do so. And then you can just make it public so your course coordinators can actually view it as well, and click Save and Return. So you can see here that you have one learning and practice hour and the date. The new enhancement to the system will actually record an hour box, so there will be a column with your hours, so the title will be learning and practice, and then you can record just your hour, which will have a total at the end of the page. To add an entry such as your case study assessment, you will follow the guidelines sent to you from your course coordinators, which will be available via the message board on this system. But for an example here, you can put in case study 1, Then you can put the date that you upload it. Now you can either select a file here and put it in, or if you're choosing to put more than one piece of evidence in or one file to support this entry, then you can do it via the evidence box. For the time being though, we'll just put it in here. So just find the file, upload it, and then you can put a description here. I believe you have to link the case studies to some of your competencies, so if you chose to do so and follow the guidelines that will be sent to you by your course coordinators, you could put in which competencies that they relate to here, for example, and then save and return. Another example of a journal entry is that you can add in a reflective journal. So this is just a reflection on your own practice that's just available to you. So you can just call it something. This is just an example. And then you can put in a description. And obviously this can be quite long. And then you can make it personal and then save and return. And then if we have a look at the types here, you'll see that there's public and personal types. So if we wanted to see just your personal reflection, so your personal entries, you will see that here. So no one else will see these apart from you. And if you look at your public entries, it will show you just your public entries. So this is the page and the entries that your course coordinators will view when they actually access your system to monitor your progress during the training program and at the end of the program. Now, another way you can add evidence to an entry is to click the evidence link on the right-hand side of the page, and you can upload a file, find the file, and then upload and return. And then if we go back to the journal, you'll be able to see that for that particular entry, we have one piece of evidence uploaded in addition to the case study report. If you wanted to view the entries, you just click on the View and Edit link, and you can also delete the entries. You can view your evidence history, so all the files that you've uploaded in support of your entries here, and then just to go back to your journal, you just click on Manage Journal. The final module in this training session is the help guide. We will look at how to access the online help guide, including step-by-step instructions and the video tutorials, how to use the live chat system, and how to submit errors or bugs within the system. The help guide can be accessed in two ways, either by clicking the help icon at the bottom right-hand corner of each page, or by clicking help in the navigation bar. This will open up a new window, and when you find what you're looking for, you click on the link, which will give you a link to the video or the step-by-step instructions on how to complete the assessment. You can use our live chat between 8 AM and 8 PM Monday to Friday by just entering in your message here, and one of our team will be in touch with you very soon after. After hours, you can submit a request by clicking on the link. And you can just leave your email address, the subject, and the description of your inquiry. Alternatively, you can click on the help icon, enter in what you're looking for. Here you'll find the top 3 articles that meet your search criteria, and you can just click on the link to watch the video or view the step-by-step instructions, or use the live chat as discussed before and enter in your query here. One thing to remember, if you do use the help icon, once you have finished your live chat, you will just need to refresh the page in order to start a new live chat in the future. When using the system, you may come across some bugs or errors within the system. You will normally come across a page such as this when this happens. So this just explains an error has occurred. And then in order to inform us what's happened, so we can fix it as quickly as possible, click the Copy to Clipboard button. This will open up a pop-up window, and you'll just click on the OK button. Go to the help guide on the system, type in error, which will take you to the live chat section, and then simply paste in what was on the clipboard by clicking paste, and that will be sent to us, and we'll be able to identify where the bug is in the system very quickly and ensure that you'll be able to use the system again very soon. In summary, you should now know how to access the system successfully and manage your login details, including your username and password. You will know how to view your messages, access both the Competencies and Journal modules, know how to record your formal assessments with your DMP assessor, and also record your learning and practice hours in the journal, upload your case study assessments, and also use the help guide. Your DNP assessors will be emailed the training session times, which will be scheduled throughout the coming weeks. Thank you for attending this webinar training session. If you'd like to know more about the ITEM system, you can go to our website, www.itemsforhealth.com.au, or you can contact us at support@itemsforhealth.com.au.